I'm often asked what are some of the potential complications from undergoing the LINX procedure. And I would divide these into two major categories. One are immediate complications and then the others are late. So we haven't actually had any complications from the LINX procedure itself. The operation is very safe and effective. There have been no migrations, which could theoretically happen in an early time period, and so that's great news. One of the more significant complications that can occur is erosion of the device into the esophagus. Now, there have been over 3,000 of these devices placed, and there have been 6 erosions in Europe and the United States. And we have learned a few lessons from these erosions, and it has altered somewhat the technique. Most of these were early on. However, I would note that the way we deal with these complications is the following. One, we can go in endoscopically and clip one of the titanium rods and then go in laparoscopically and remove the device. Then we usually do some type of a fundoplication, a Nissen fundoplication or one of the other types of fundoplication. So these can be managed laparoscopically. There have been no devastating complications from this operation, such as having to remove either part of the esophagus or stomach or both. So that hasn't happened. There's a very predictable failure rate and way that it fails, and it is really beneficial to the patients. From the standpoint of other complications or other side effects of the operation, there can be long-term dysphagia. So this has been very rare, but it can happen. And so we consider dysphagia after about 12 weeks to be concerning. At that point, I would tend to have patients get an esophagram and take a look, make sure the device is opening and closing as we anticipate it that it should. If it's not, we can do an endoscopy and then even open up that device within the scar capsule, kind of cracking the scar capsule, and this then helps to kind of reset the clock, go back to normal eating, and hopefully it scars in a different way. Unfortunately, everybody scars in differently, so we can't completely predict the way this is going to scar in, but we have a good idea in 90+% of patients. And our personal dilation rate at our institution is way less than 10%. Some patients ask, what if my reflux comes back even though I have the LINX procedure in? So there is a concept of pooling, which is to say that if the device is not opening and closing easily, or we're overeating, unfortunately a lot of us do that, myself included, and food and liquids can pool in the esophagus above the device as it's opening and closing and allowing food to pass into the stomach. You have to remember this is like a gate, one of those like toll gates, or when you go through an airport or a train station, it only allows so much food and liquid to pass through at any given time. So if we overeat, it can pool in the esophagus, and this can feel like reflux even though patients are not truly refluxing. Occasionally, patients can develop reflux, true pathologic reflux after the device is placed. With the device, our goal is to make patients feel normal, not super normal, which is really what a Nissen does. So it's designed to restore normal function. Reflux is a normal part of everyday living. We just are trying to diminish the number of reflux events throughout any given day and night. So if you do happen to have reflux after the operation, what we'll do is we'll usually do an endoscopy and some other testing to really prove that you are having reflux and it's not pooling or you're not feeling the symptoms of reflux. So we want to prove that you have it. If at the end of the day you need to be on a small dosage of medication or even look at doing another operation, the nice thing to know is that the LINX device does not burn any bridges. We're able to take it out very easily. That's about a 10-minute to 15-minute procedure, and it can come out and we can redo the operation either potentially with another LINX, although that's rare, or more commonly with a more traditional fundoplication like a Nissen fundoplication.